Hello, my name is Penny McSorley and I'm Head of Nursing for Abdominal Medicine and Surgery in Leeds Teaching Hospitals. I first met Becky around 10 years ago now when she was a patient at Chapel Allerton and I was a matron covering rheumatology. Becky's got Ehlers-Danlos syndrome, which is a rare connective tissue disorder which leads to lots and lots of problems with pain and spasms and general health problems that cause the sufferers to be in hospital for long periods of time and have very complex needs. Becky has a permanent catheter in place which requires changing regularly and is a patient on some of our wards in abdominal medicine and surgery. When I first started in post, I met Becky again and we were having lots of difficulties when Becky was admitted for catheter changes. And it became clear that we needed to have a different approach to providing care for Becky when she did come in for her catheter changes. It became clear that we weren't always getting the care right and individualised care right for Becky. And this did culminate in Becky feeling that she had to make a complaint to the service about what she'd experienced. It was from there that we realised that we needed to take a different approach to Becky's care. It needed to be much more individualised, much more coordinated, and it needed to involve her.
Hello, my name's Linda Johnson. I'm matron for urology at St James's Hospital in Leeds. I first met Becky 3 years ago when Becky needed to come into hospital to have her catheter changed. And what we didn't realise or understand was the amount of anxiety and distress that this caused Becky. We now have managed to get her catheters changed every 3 months, which means she only has to come into hospital 4 times a year. And I think in meeting Becky over the period of time, we now see Becky as a person rather than a patient that comes in for a catheter change. And I think we realise now just how complex Becky's needs are, but we now see her as a person.
Hello, my name's Rebecca Kenny. I'm senior sister at St James's Hospital in Leeds. I work on the urology ward on J42. I started here in about February 2016 when I first met Rebecca. She had come to the ward because she was having a monthly catheter change at that time. And I think there were numerous issues at that time with her equipment that was coming in. We didn't always have the right equipment, didn't always have the hoist charged. She was going between my ward and another ward, which was also giving a bit of discontinuity with her care. Not all the staff felt familiar with Rebecca's complex health issues and what pain relief and support she needed when she was admitted for the catheter change on a monthly basis. Since then, myself and Rebecca have been able to develop a much better relationship. We've been meeting with Rebecca, myself, one of the matrons, and people that are in Rebecca's life day to day, her carers and people from the community. And all of us together have sat down with Rebecca and had a conversation about what she wants from her admission into hospital and what we can do to make her admission into hospital better. My staff now have a much better understanding of what the plan is for Rebecca when she comes into hospital. We've introduced her carers staying with her on a night time, the pre-op night and the post-op night, so that she's got somebody with her that she feels familiar with. She's got somebody that can come out and get help if they need it. She's got somebody that she can talk to so she don't feel as isolated because she generally is in a side room as well. We've also looked at getting more of Rebecca's equipment being brought into hospital. So she brings with her own commode now, her own slings. So we have worked together with Rebecca and the pain management team. Within our meetings, we meet regularly after Rebecca has a catheter change, and the last meeting we were able to put together a plan of different types of analgesia that she can have. So medications that Rebecca can take before she has the catheter change and medications that Rebecca can take after she's had the catheter change. Up until having these regular meetings with Rebecca, it was something that I think myself and my team weren't really aware of, how actually anxious the 3 or 4 days up to coming into hospital Rebecca actually gets, and how disruptive coming into hospital once a month is to her life. So 3 monthly catheter changes have been much better for Rebecca. She's been able to have a much more normal life and not be ruled by the catheter changes and on a monthly basis. Also, what we've really worked hard to do is make sure that Rebecca gets out of hospital quickly and effectively, because Rebecca doesn't want to have a prolonged stay in hospital. She's ready to go back into her normal routine and get back to everyday life.